Good evening, welcome back on my YouTube channel. Thank you so much for watching my YouTube videos. My name is Saima. I'm a nurse trained from Pakistan, currently working in the UK. If you are new to this channel, my channel provides information about UK nursing and lifestyle of a nurse here in the UK. If you're interested in these videos, please subscribe to my channel, and then you can share it with your friends also who are aspiring to come to the UK. My beautiful family, thank you so much for coming back, watching my YouTube videos. I really appreciate that you like this, you like my videos, you subscribe to the channel as well. If you are new, please consider subscribing. If you are coming back, thank you so much. So without any further delay, we are going to start this video. In today's video, we are going to talk about why you should join NHS than care home or agency. So I will give you at least 15 to 16 reasons to consider working in the NHS than in the care homes or agencies. So if you're interested in this topic, please watch the video till the end. A lot of overseas nurses, they ask me like whether they should join NHS or they should consider privately working privately in care homes or agencies. So this video is for them specifically. If you are thinking to work in the UK, work as a nurse here in the UK, I would suggest you to work in the NHS because of these reasons. I will discuss all the reasons with you. Number one on the list is pay enhancement. When you work overtime, when you work weekends, when you work holidays, or when you work as bank shifts. Sorry, there was a call incoming. I forgot to. So the number one on the list is pay enhancement. When you work in the NHS, you get enhancement for working on the night shift, for working on the holidays, or for working on the weekend. So if you work in agency, you don't get this opportunity. You can do overtime maybe in there also, but there is no pay enhancement. And also when you work on the bank holiday or weekend, you get extra money as well. This is a plus point working in the NHS. Number one was the pay enhancement. For the pay enhancement, second thing I have is every year you get pay enhancement. So let's say it's my first year, and after first year, the second year, you get the pay enhancement. Let's say I join the trust on 13th of January. So next year, 13th of January, my pay will be automatically increased. I don't need to do anything. I don't need to ask the HR. I don't need to ask my manager to increase my salary. So automatically every year you get the pay enhancement, you get the increment. If you see your pay slip on the salary slip, on the top bit it's written that increment due date. So every year with the date of your joining, automatically you get pay increment. That is a really good point. Consider working in the NHS, guys. Number three I have is a study leave. If you study in the trust, the NHS provides you opportunity to do that. They give you hours to study, and then while working you can study as well. Let's say if I want to study part-time MSc, I can do it, and my trust will allow that. They will give me opportunity. They'll give me working hours and the study hours that I can do. So I don't need to quit my job. I can study while working. That's a good point. Working in NHS, when you work in the care homes, you don't get that opportunity. Number four is annual leave. When you work in the NHS, you are entitled for the annual leave. Whoever joined the trust, like whether you are a cleaner, you are a housekeeper, or you are a healthcare support worker, you are entitled for the annual leave. When you join the trust, immediately you are entitled for the annual leave, and it's a lot. The annual leave you get, they are lots. I mean, you get 268 hours, and it's like 11 weeks or something. So honestly, when you have that amount of time on annual leave, you can work on these hours. You can do bank shifts. It's a good opportunity for you to work extra. That was number four reason for you to join the trust, NHS trust, than working as part-time or private care homes. Number 5 I have is agency shifts. When you work in the NHS, you get the opportunity to gain some experience. When you are new in the UK, if you go to care homes or nursing homes, they ask you for experience for at least 6 months. So from where you're gonna get that experience? If you work in the NHS, you can join the agency later on, like after working in the NHS for 6 months, then only you can work elsewhere in the UK. Elsewhere I mean in the private care homes or nursing homes or any other trust. So you should have some experience if you want to work somewhere else. So this is a good point to consider working in the NHS. So number 6 I have on the list is career progression. When you work in the NHS, you can apply for like there are loads of opportunity for trainee nurses, or let's say a trainee diabetic nurse, or trainee health practitioner, or trainee clinical educator. So there are loads of opportunities for you for career development, for career progression. You don't need to stay on your band 5 post. There are loads of opportunity, there are loads of jobs. You can see like you can check in the NHS website every now and then you can apply for those posts for the career progression. And most of the times you don't need to go somewhere else, like you can do it in your trust. Let's say I work as a nurse in my trust, and there is an opportunity for trainee doctor or trainee healthcare practitioner, HCP. You can do it as well. So I don't need to go somewhere else, I can do it in the trust, and my ward, my managers, they will allow me to do it. I just need to tell them, take their permission, and then I can go on leave for 1 year or something and do that training. If it's for 1 year, I can do that. If it's part-time, I can do it with my work as well. So this is really good for the career development. If you want to, if you work in the NHS, you can do it. If you go in the care homes, you won't be having this opportunity. Number 7 on the list is for your career development as well. So for career progression, like we have a appraisal system here in the UK. So every year they do your appraisal. The managers or the nurse in charges, they do your appraisal, and then they ask you what are your objectives for the next year, for the coming year. So you need to fulfill those objectives in order to develop your career, isn't it? So for the career development, it's really important that your appraisal, your managers, they do your appraisal and they ask for your career development, what you want to be. Most of the times when I do appraisal for my support workers, I ask them, and sometimes they say I want to be band 3 healthcare support worker. So it's a good opportunity. So what we do then, we liaise with the managers, and then we give them chance to do that course or to pursue their dream. If they are band 2, right, they can tell me that in their appraisal, they can tell me I want to be band 3, and then this is their objective. I can write it down in their appraisal form and discuss with the manager. When the opportunity comes, we will give them chance because they mentioned it, they asked me, right? So it's a really good opportunity for career development also, the appraisal Number process. 8 on the list I have is sick leave. When you are sick, you can get sick leave in the NHS, so you will be paid for that. If I work in a private care home, I will not be paid for my sick days. I will just be off. So if I'm sick here in the NHS, I'll be paid for that for 7 days. I don't need any doctor or GP consultation to say that I am sick, or I don't need a sick leave, I don't need a sick certificate. So it's a really good point working in the NHS, that you don't need to give any certificate for 7 days. If you do sick leave more than 7 days, or then you have to see your GP and they can give you a sick certificate. So it's good, isn't it? Please let me know if you like this video. Just let me know in the comment section, and I'll be very happy to read your comments. And also I love answering your queries, guys. Honestly, if you have any queries, any question, let me know in the comment section. So number 9, my favorite, maternity leave. So you get maternity leave for 12 months, and it depends on the organization how they're going to pay you. In my trust, they pay like full pay for first 2 to 3 months, I think, and then half pay, and then for the last 3 months there is no pay. So it depends on your organization how they do it, but the good point is you get maternity leave for 12 months. Isn't it nice? Like, it's amazing. Your baby will be 12 months old when you go back to work, so you don't need to worry too much right? And if you are a lady, it's really good for you. But also my next point is number 10 is paternity leave for the boys. If you are a male nurse, or if you are a male healthcare professional, you are entitled for the paternity leave. But unfortunately, paternity leave is only for 2 weeks. So sorry, boys. So paternity leave is only for 2 weeks, but it's still good, it's not bad. You will be paid for that paternity leave, so at least you can help your wife, your spouse, to in their early days of after delivery, to help them with the child care for the first 2 weeks. I think it's really good. For 2 weeks also, it's not bad, and then you will be paid for that. So maternity leave, paternity leave, you are entitled for that in the NHS. Number 11 on the list I have is parental leave. Parental leave means if your child is sick, or you need any emergency leave, or they, like if they are sick, or if they have any problem in the school or something like that, so you are entitled for 18 weeks parental leave per child. If you have 3 kids, you are entitled for 18 weeks parental leave. But it depends on your managers. When you call them, tell them that I have childcare issue, or my child is sick, so they can mark your leave appropriately. Instead of writing it emergency leave or something like that, they can put it as parental leave. You are entitled for 18 weeks parental leave, guys, in the NHS, if you work in the NHS. Talking about parental leave, you also have number 12 on the list is shared parental leave. I mean, if you are a same-sex partner, same-sex couple, or one of your or your partner delivered a baby, or you adopted a baby, so you can help the your partner with the child care, and you are entitled for the shared parental leave as well. You just need to discuss it with your manager, and then they will allow you for your shared parental leave. You can help them. Let's say your partner delivered a baby or adopted a baby, so half leave 6 months you can take, and the 6 month they can take your parental leave, shared parental leave. Number 13 is bereavement leave. Bereavement, if someone in your family or if your loved ones passed away, you are entitled for bereavement leaves, or leave of 2 weeks. I remember, I'm sorry, my grandfather died, and that time they gave me bereavement leave for 1 week. It was a difficult time, but you are entitled for the bereavement leave, guys. If someone you love passes away or die in the family, I'm sorry to say, but you are entitled for the bereavement leave if you work in the NHS. But if you work in the care homes or nursing homes privately, they don't give you the bereavement leave. Number 14 on the list is NHS pension. You are entitled for the pension plan. Pension, if you NHS pension is really good, and they pay you a lot on your retirement when you leave that trust. And also, like when you get your pension, it's a huge amount, honestly, guys. They say it's a huge amount, and to be honest, I ask many people for the pension how much they're getting. They never tell you how much they're getting, so I honestly have no idea how much they are they are given. Only one Filipino nurse, she told me she was given 500 pounds per month. So you are if you work in the NHS pension is really good. The number 15 on the list is NHS discount. You get a blue card. If you get, in some organization they say you get a smart card, and then wherever you go, wherever you shop from, you get discount. Sometimes there is discount, 30% discount on Adidas, 30% on any other brands you can get the discount. So always use your blue card for the discounts. Sometimes they have offers and discounts on the grocery as well. So if you have the blue card, just consider applying for it. If you don't have it, just apply it on the website, on the intranet, and then you will be given a card. It's really good. There are loads of discounts. There are loads of discounts on the, mostly on the designer clothes, on the on the shoes, each and everything, and the restaurants as well. So consider checking it with your organization if they have any kind of a card. Most of the NHS trusts, they do have, sometimes they call it smart card, sometimes they call it blue card, blue light card. So just ask them if you don't know about it. 16 on the list is when you work in the NHS, it's way too easy for you to change a job. Let's say I'm a band 5, but there is a post for band 7 or band 6. I can apply for it, I can go for an interview. If I'm successful, well and good. If I'm not, there's nothing to worry, I can go again, do it again. So it's really easy for you to change a job. So what happens is sometimes they post jobs for secondment also, like let's say like 6 months secondment or 12 months secondment, and this post is for 6 months. This secondment means like this post is for 6 months, and if they like it, if they like your work, if they like your way of working, each and everything, if they like about you, they can give you opportunity to continue, or they can give you permanent job on that post. So if it's a second opportunity, don't worry, just go for it. Apply, give interview, and whether it's for 12 months or 6 months, just go for it. At least they're giving you opportunity, you will gain experience, and later on if they like you, they can give you, they can consider making you permanent. All right, so it's really easy for you to change job in the NHS. Also it means if I'm a medical nurse and there is an opportunity for high care, surgical high care, or in ICU, I can easily apply, go there and work for some time. Or if you want to leave, if I want to leave this job, medical nurse job, I can do it, and then later on when the opportunity comes somewhere else, I can apply and work on that particular post and learn a lot of different experiences, learn from the experiences as well. So it's a good opportunity. If you work in the NHS, it's easy to change the job, and then it gives you opportunity to learn different ward experience, to learn from them, and also learn different kind of medical equipments, complex equipments. Also NHS has like way too good equipment, like advanced equipment and technology, so you can learn how to use them. Over jack and mat, I didn't know that how to use that to lift the patient up. I didn't know, honestly. So over jack and mat, we use that one to, if someone falls, so we use that one to lift the patient up. And there is always a way to learn those things, and they give you opportunity, they give you time and training to learn those equipments and those things. So it's really good that NHS teach you how to use those equipment. So if you go directly in the care home, you won't have that chance to learn. And if they have that equipment in the private care home, how would you know how to use it? And it will be embarrassing for you if you don't know how to use it. At least here in the NHS, when you are a new nurse, they give you training to learn it in the beginning. Like when you are brand new nurse, they give you training for each and everything, for each and every equipment that you can come across in the ward. All right, so what do you think about these benefits of working in the NHS? Do you like it? I would say consider working in the NHS at the beginning, let's say for 3 years, and then if you like it, stay with the NHS. If you don't like it, go with the care homes or private setups. Because what I heard a lot from people is, like in the care homes or in the private nursing homes, the workload is less. Obviously the workload will be less because they are the short organization. Sometimes they have 20 patients, sometimes they have like 30 patients or 50 patients. So obviously the workload will be less, but there will be nothing to learn. There will be like very less to learn. If you are going to work in the NHS, there will be lots of opportunity for you to learn, for your career development, for your career progression, for pay rise also, and also sick leave, annual leave, bereavement leave, loads of leaves as well. So I think it's a good opportunity to start with the NHS, and then later on, if you want to change it, go ahead and change it. There will be no one stopping you to do it, to do that, to change the job. If you here, honestly, if you say that I'm not happy working here, I want to quit my job, I want to go, nobody will say anything. They would just say, if you're not happy, that's fine, that absolutely fine, and go ahead with your dreams, whatever you want to do. Honestly, they don't criticize, they don't discriminate you for that. They just say, if you're not happy, it's fine. They consider mental health very, very important, and for them it's really okay to say, it's okay to say sorry. If you're not okay, it's okay to say it, that I'm not okay, and then nobody will sorry, nobody will say you that oh, you just joined the trust, or you haven't completed your contract. It doesn't matter, it doesn't matter. Whenever you want to leave, you can leave. You just need to give the notice period. And I honestly think that it's better to start with the NHS, learn those equipment, learn those, all the training, get all the trainings, and then you can move on if you want to. One more thing is, there are loads of free learning tools. There are loads of trainings that you can take on the hospital intranet page. If you want to do BLS, if you want to do any moving and handling training, infection control, diabetes nurse, infection prevention control, infection prevention nurse, or alcohol nurse, there are loads of trainings that you can do. Anything you can think about, you can do those training, and they are completely free learning tools. You don't need to pay for anything. But if I work in the care home or a nursing home, and I want to have that training, I probably need to go and do it online and pay for it. So here in the NHS, on the hospital intranet page, they give you the opportunity to do those courses for free. You don't need to pay for anything, you just need to enroll, and then you can do it. And the good thing is, your managers, if you're working on that particular day when you have that training, let's say I have a BLS training today and I'm working long day, and this BLS training is for 2 or 3 hours, and I'm working long day, my manager will not have any problem for sending me there for the training. They will allow me to go for the training. They will never stop me saying that we don't have staff, or if she has to stay in the ward, she would stay in the ward and then send me for that training. So it's really, really helpful. They permit you, they give you permission to go ahead and do the trainings, because they want you to be trained, they want you to be perfect on each and everything. And also, if I want, let's say I want to do a dementia course, I can enroll it on myself, for myself, and then tell my manager that I have this training on this particular day, and then if it's for 6 hours or 7 hours, they can put that day study day or study hours, and then they can give me off also on that day, so I don't need to go to work, I can go and do my study. It's really, really good, guys, for your career development, for your personal knowledge. It's good that you book yourself, you enroll yourself for these trainings and learn from this, because at the end of the day, they are giving you the opportunity. You will be given the time for those trainings to do it, to do those trainings, and there is no harm. If they are giving you opportunity, just do them. Just take the study hours. And I've done so many study hours, because what happened is, when I was new, I'm really passionate about studying further, honestly. So whatever training I come across, I would just enroll myself, and I'll ask my manager if I can do it, or most of the time I would do them in my off days, because it's only 1 hour or 2 hours online course, so you can do it, I think, just to gain some knowledge. If you feel like you are weak on that particular topic, let's say if I'm weak on the diabetes mellitus, I can go on the internet page, I can book myself for the diabetic training or something like that. So it will boost my knowledge, and skills in the blood sugar monitoring, or if I have diabetic patients, I can learn how to deal with those, how to deal with hypoglycemia or hyperglycemia, what symptoms symptoms and signs they can have. So it's really good. You are a nurse, you should know each and everything, I think. And then you spend more time with the patient than the doctor. So if you are observing a patient, you need to know what symptoms they are experiencing, what signs they are having, and what can be the reason of that. So that's it for today. If we continue talking, I will go on and on and on for so long. So sorry for taking you this long, guys. If you like this video, please consider subscribing, sharing it with your friends and family. And if you have any questions, please do let me know in the comment section. Please rate this video. How was today's video? Do you think that NHS is better than the private care homes? Very soon I'll be making a video on working in the nursing homes or care homes. What are the benefits and side what are the pros and cons of working in the nursing home or care homes. Okay, so stay tuned for that. If you like this video, please give it a big thumbs up, share it with your friends and colleagues. I'll be seeing you soon in the next video. Take care. Bye bye. God bless you.